It falls down to one person, Paul Anderson.
It was his vision to be able to go to everywhere in Idaho.
I was so inspired by Paul Anderson's legacy.
I made the comment early on when we first started the whole system of EMS and StateComm that state communications, when we was on the ambulance, was just like having a doctor sitting next to us.
I had read every journal article he wrote before I even applied for the job, just in the course of being interested in the subject back in Maryland. And his vision of a seamless communications network that would assure that any ambulance, no matter where they were, any EMT with a handheld two-way radio, any crew that was lost or couldn't get the hospital to answer them on the radio, had someone listening out for them. That carried with me throughout my 2 decades serving as the EMS Bureau Chief.
I'm Paul Anderson. I started as Chief of EMS in Idaho. I was the first statewide Bureau Chief for EMS starting in 1973.
We've been with StateComm ever since its inception, and it's helped us tremendously down through the years.
We had a mandate, a small EMS staff, myself, to put a statewide system into operation, implement it in Idaho.
Because StateComm backfills and supports so many local 911 centers in Idaho, we felt it was important to rise to the gold standard of emergency medical dispatcher certification. All of our dispatchers took the course, passed, became certified. That gave the counties who were unable to avail their personnel of the same resource the option of passing the call along to StateComm to enable our communication specialists to provide pre-arrival instructions to Idaho citizens, especially in very rural and remote communities. I'm especially proud of several occasions, and there are too many to list, but a communication specialist who talks a father through birthing his child, the communication specialist who talks a frantic neighbor through how to care for their friend who's been shot multiple times, the opportunity to talk an Idaho Transportation Department construction staff member through how to care for his severely injured friend. Those are so important, and a phenomena that the citizens don't even realize is happening, and how complicated it was to get that call from several hundred miles away into the center meridian and make the best possible outcome happen for the patient.
Looking back on the 6 years that I've been the Bureau Chief, I am so thankful for the visionary work that Paul and Dia did before me. I think that really set us up for great success in leveraging StateComm as the communication hub for the emergency responders throughout the state.